sure everybody who's here already knows, I'm Dr. Julie McCullough, and I work in the Maternal Fetal and Infant Research Centre along with Marlene and Frank on the PEXIT project. But one element of the research that I have been involved in for almost 5 years now has included the use of social media. And using social media in research can allow researchers and research teams to connect with research participants, other researchers, organisations and the general public to develop and share and disseminate research and research findings. So today I'm going to talk briefly about what our team has learned from the Connecting People project. And that work has been used then to further develop the PEXIT project. The Connecting People project involved the use of social media to connect with parents who had children with congenital birth anomalies. These included congenital heart defects, but also spina bifida, Down syndrome and children with cleft lip and palate. And that research was designed to connect with parents so that we could learn from them, learn from their expertise by experience, and also to enable us to work in co-production to develop a list of research priorities. And this work has been published and you can find it there using that link in the QR code. And we'll also share it after the conference as well. So like all elements of a research project, social media has the potential to be it. And research has identified that there may be a divide in the viewpoints of researchers and whether or not social media should be used for research and how to use it effectively. And sometimes have identified that healthcare professionals and organisations were maybe lagging behind patients and the public in their use of social media for health communication. And that many researchers were actually uncertain about using social media for professional activities. And in fact, this tended to be younger researchers who had these concerns. However, as we're all learning from COVID, that has changed so many aspects of our lives and has led to support for the rapid uptake of social media by support organisations, researchers and medics. And not only has there been a really rapid growth in the number of research projects and papers published that have used social media, but scientists and healthcare professionals and researchers have really become regular contributors to information shared on social media, and we're all becoming more aware of that. In addition to this, there's so many global research and health-related organisations who are embracing the use of social media that it's really as a natural step to include it in the development of research projects. So I'm going to share some insights and some key points for consideration from social media research that I have learned working in the team with Marlene, and hopefully demonstrate that it can easily be incorporated into research projects and it can be a really valuable tool for researchers. So most of us know that there is a real plethora of social media platforms that exist. And as you can see from this slide, the most popular form of social media is Facebook. And that has been the case that Facebook has been head and shoulders above the rest since 2012. Facebook was also the most commonly used form of social media identified in a scoping review carried out by myself and Marlene as part of the Connecting People project on the types of communication methods that were used by congenital anomaly support organisations, and that was all across Europe in 2017. This slide shows that there are 2.74 billion users of Facebook, which whenever you consider it, that's almost a third of the global population. But whenever we think about the number of children under 13, which is the minimum age to have a social media account, then it's actually likely closer to about half of the global population who have a Facebook profile, which is quite incredible. In this next slide here, that seems to be confirmed, where it states that social media users account for about 53.6% of the global population. And also an interesting statistic on this slide is the final infographic that shows 98.8% of users connect using a mobile device. And indeed, the research has demonstrated that the availability of mobile devices increased the use of social media too. So through the Connectee People project, we also identified that parents and participants prefer to use social media to connect with support organisations. And that's the bar along the bottom of that bar chart. And the reasons that they were given by the Connectee People participants was the greater accessibility to different groups in a greater number of locations. It was also to do with the speed with which they could make the contact, and having visual choices was really important, that they weren't just relying on words and text. Social media is easy to use, and multiple links are available to allow parents to access the different types of information that they need to answer the questions that they have. And also social media is available 24 hours a day. And again, mobile phones are the main method of connecting to the internet for the participants that we spoke to. So we know the names of the social media, and we know that the public and parents and organisations use, and they're happy to use social media to connect with others. And the findings from the Connectee People project and studies by other teams that have been led, for example, by Greenwood and Russell and Owens, that the public want to connect with research, and they want to connect with research that's taking place on social media. But what really defines social media? And I know that might seem like a question that we can all very easily answer, but when we think about it in a more technical way, then it can help us to identify the most effective ways to use social media within research to engage with participants in a meaningful way. And social media is much more than just a tool to connect people, because if that were the case, then a telephone call or meeting somebody in the park would also be social media. The key defining element of social media is that it's based on and exists because of user-generated content. And user-generated content includes all of the data and the posts and information that people who use a social media platform or are involved in a social media group share with the rest of the group. And that can include things like words and text and comments, but also emojis and videos and photographs. And the sharing and discussing of this user-generated content leads to the development of cohesive online communities. And this should be encouraged and developed and facilitated by researchers. And that's not always easy, especially when researchers themselves may not have the first-hand or lived experience of the topic under investigation. Therefore, as researchers, once we understand this most basic requirement for social media, it can assist us in developing successful social media groups to gather quality research data and to work collaboratively with research participants. And the key to determine who will act as the key to determine this is defining who will act as administrators and moderators, and their experience with the research topic and of using social media and connecting in a safe and meaningful way with participants is important. Researchers need to plan and incorporate social media into research projects, and that really has been strongly recommended by Elliott et al. And Lavari has recommended using multiple social media channels to meet the needs of the wide range of participants and maximise the different functionalities of social media. So, for example, Facebook is an ideal social media type for group discussion, while Twitter is more of a broadcast medium. The digital infrastructure must also be considered, and this includes access to devices, access to internet and social media accounts, and that needs to be taken into consideration for us as researchers and also for the intended research population. So research teams may in the past have dismissed incorporating social media as they can maybe have been able to easily identify participants. However, social media really allows us to connect with groups who might be socially, geographically or culturally hard to reach. So for example, that could be, as in the case of the Connectee People project, parents who are caring for very young or sick children, or who would be living in very remote areas. So no one was as remote as an igloo, but all of the parents who had worked on the Connectee People project with us were spread right across Europe. And certainly as well as a result of COVID, this has led to a cultural and societal shift on how we can now connect in person. And the research suggests up to 72% of people have increased their social media use during the pandemic, and this has included increase in the number of searches for health advice and information. And the Connectee People Facebook profiles had visitors for 35 countries, as you can see in this map here. And if that had, that just simply would not have been achievable, that we would have had people involved in the research and in the dissemination if it hadn't been for the use of social media. So this next slide is just to demonstrate that any of the traditional research methodologies can effectively and efficiently be carried out online. But what recruited participants will be asked to do will still be required, for the most part, ethical approval. And staying safe online and offering support is really an essential consideration for researchers who are engaged in social media research. While the topic for discussion, the topic for discussion with participants is sensitive or private or confidential, private and visible Facebook groups are an ideal choice. A private and visible Facebook group are invisible to the public, and membership is by invitation only. And compared with a public Facebook where everyone can see it and everyone can interact with it. Social media research commonly requires participants to agree to rules of engagement, and I much prefer the term a group agreement as it seems more inclusive. But these rules commonly ensure courteous conduct by all members. And social media groups typically offer a source of support to the members and peer support, and members really tend to value that within the group. So how do we connect with research participants in social media? And well, that all depends on the type of data that we want to collect and the aims and objectives of the study. And in the case of the Connectee People project and also the new PEXIT project, participants were recruited face-to-face, either online or in person by our colleagues at the Clark Clinic. And they were invited to join the social media group as part of the research. But we can also advertise recruitment posters via social media. And also we can share surveys on social media. And the general public or any interested party can follow research accounts, and they can share and facilitate dissemination in this way. Social media can also be used to broadcast a general call to followers to share information that can be used to further research projects, and such as this post that we can see here from the DMRS account that had been prepared for focus groups relating to breastfeeding. One important benefit of social media is the availability of social media analytics. And these can be accessed quite simply if you have a social media account, and used to determine the reach, engagement, and number of interactions. And they can also be used to analyse different posts to identify what has had the greatest impact and what has been important to followers. And these are important, reach and impact are important metrics for researchers. And all of the definitions of the types of metrics that can be collected can be found online and others as well. There's also advanced metrics that are available on some of the social media sites that can offer further insights as well. So in order to achieve all this and to get meaningful data and content from our social media groups, we need to put meaningful data and information in. And this leads us to the first most important key requirement for researchers when using social media that certainly I think myself and Marlene has identified from the work that we have done, and that's time. We need to dedicate a lot of time, not just to check and post information, but also to develop the virtual community and to curate content to ensure that the information that we're adding to our groups is usable, that it's understandable and valuable to our research participants, and it's something that they want to discuss further and they want to learn from and share their thoughts and experience so that we can learn from them. We also need to be able to continually evaluating and updating the content, including banners, and that requires a high level of creativity that I'm sure Marlene could attest to that I don't necessarily always have. But time is also must be given to allow participants to feedback and to have the opportunity to engage, as some of them may have limited time if they are carers, for example. And they may also have difficulties maybe around language that will require additional help to engage, or they may only be able to connect at work or at certain times of the day. Making time will build trust, which has been found to be a major factor in the success or failure of social media groups. And Heath et al. States here that participants' decisions to participate in research via a particular method were determined by personal convenience, their belief in the ability to be open with the researcher despite potential upset caused by the topic, and their ability to really get a feel for the researcher. So investing time in developing strong interpersonal relationships pays dividends not only on social media, but also in the same way that we would build that rapport and face-to-face in-person contact. Curating content is a really important aspect of using social media, and it refers to the way in which information is collected and values added so that it resonates with the audience or research participants. And this is particularly important for dissemination platforms. Sharing links is rarely enough, and when we share information that has been tailored to our social media groups' needs, they're much more likely to interact and engage and enable researchers to collect new and meaningful research data. So I hope that this has been helpful to anyone who's thinking of embarking on using social media for research, or anyone who maybe has felt that engaging in social media had little to offer them or the research projects. Social media is certainly evolving really rapidly, and new social media platforms are appearing all the time. But I hope that I have been able to demonstrate in a small way that social media is a credible and sustainable choice for engagement and research. So thank you all very much for listening.